Hello, Community Action. Good morning and good afternoon. My name is Denise Harlow. I'm the Interim Chief Operating Officer here at the Community Action Partnership, and we're thrilled to have you on the web today with us for our Office of Head Start update. We're thrilled to have a panel of speakers that you can see here joining us to give us the latest and the greatest from the Office of Head Start. We know a lot of things are going on. Head Start certainly impacts a significant percentage of our networking community action. And we know that when Head Start and community action are embedded with one another, the impact for families is significant. So again, welcome to today's webinar. We are going to be recording today's webinar, so please note that. There are a large number of people on today's webinar, which is great. We will be recording this webinar. We'll be recording it. It's because there's so many folks, we're not going to be able to unmute you. So in the lower right-hand corner of your screen, you'll see a Q&A window. We ask that you put your questions into that box or the chat window, and we have some folks behind the scenes who are going to be providing those questions here to the Office of Head Start folks who will be responding periodically as we go out through today's conversation. We have with us today certainly Linehan, the Acting Director at the Office of Head Start. We have Adia Brown, the Monitoring Lead, Ross Weaver, the Director of Quality Assurance Division, Belinda Rinker, the Senior Policy Analyst, and Fran Majestic, Director of Program Operations. So again, to have this wealth of knowledge and information and experience in the room is really great, and we appreciate the cooperation and partnership with the office. Before we get rolling, though, I'm going to turn the ball over to Biz Steinberg. Biz, as you know, is our primary Head Start liaison. She's on the board of the National Head Start Association. She works closely with us when we do our Head Start town halls and our Head Start updates, and she's also the third vice chair on the Community Action Partnership Board. So with that, Biz, please give us a welcome.
Good morning. Thank you, Denise. And I was going to say good afternoon, East Coast. Happy lunch break, Midwest, and still good morning here in California. It is our honor today, and thanks to Ann and her team for being with Community Action. I wanted to just give a couple thoughts about Ann and her role. I've known her quite a number of years, and for all of you listening, Ann has worked in the Office of Head Start in a variety of roles, at least 15 years, and the Deputy Director before serving now this past couple, well, it's almost a year, right, Ann? As the Acting Director of the Office of Head Start. And I do want you to know that Ann began her career as a special needs teacher. So when we think of Head Start and our full inclusion of young children with challenging behaviors or medical issues, we have someone at the helm who has done that. And she served also, for those of us in the nonprofit world, she served as the executive director of a nonprofit back east, where she had Head Start and child care in 8 counties. So she is very accomplished in her experience with children and families, as well as having her education degrees in sociology and psychology, and additionally her master's in education. What I have appreciated these last few years is her knowledge of Head Start as we're going through these changes, but also her collaborative spirit with Community Action, and most importantly, how she has been working with Jeannie Chafin from the Office of Community Services over these last few years, because we need to work together in Community Action and Head Start, as Denise said, to meet the ever-increasing needs of our low-income families and their children. So, Ann, you and your team, welcome, thank you, and I will be quiet so you can lead on. Thank you again.
I don't know, Biz, you being quiet is quite a challenge, but we'll see. But thank you very much, and we're so pleased to be here, and thank you for the very gracious introduction. I'm going to ask my colleagues, who are much smarter than me on any given day, to introduce themselves to you, and I think most of these faces will be familiar to you. And I'm going to start out with our newest person to my right, who actually just became a Fed, but I think many of you know her from her work in the Head Start community over the probably a couple of decades. And I'm just going to have them introduce themselves, and then we'll get back to the updates.
Thanks, Ann. As the new person, I'm Belinda Rinker. I'm a Senior Policy Analyst at the Office of Head Start. I've worked in the Head Start world for about 30 years and really appreciate being here today.
Hi, I'm Adia Brown, and I'm the monitoring lead in the Quality Assurance Division at the Office of Head Start.
Hello, Ross Weaver. I'm the Quality Assurance Division Director with the Office of Head Start. I've been in this position now for about 4 years. Prior to that, was in Region 8 as the Regional Program Manager with the Office of Head Start.
Hi, I'm Fran Majestic, and I'm the Director of the Division of Program Operations in the Office of Head Start, and that position works with all of our regional offices and the staff within them. And I've been in Head Start for about 30 years. I started as a mom in a community action program in Head Start a long time ago. I'm glad to be here. Thank you.
Well, as both Denise and Biz said, there's a lot going on in Head Start, so we're going to give you some updates, and then we certainly brought the right folks who can address the, you asked us to address in particular 4 or 5 areas that mostly had to do with monitoring and DRS and class and the 5-year grants and the partnerships. But let's start out with kind of a broad brush of things that are happening in the office right now. Clearly, the Early Head Start Child Care partnerships are kind of like the biggest news on the block, and just today we have completed 6 weeks of paneling the applications. It was, and maybe some of you that are in the audience today, in fact, came to Washington, D.C. to help us panel. I can tell you that it was a very arduous task, and we're glad that it's winding down. I'm sure our Fed who's heading it up, Shauna Pickney, is particularly glad because she's been at the hotel held up for the last 6 weeks. Having said that, there are some important things that I want to share about the way in which we're going to approach the funding of these partnership grants. I don't know if all of you caught an announcement from the White House that came out, I want to say late last week, where the President announced on December 10th there would be a White House summit, and its focus would be early childhood education. And in announcing the summit, the announcement also included that at that time there would be the revealing of those that were successful applicants in the Early Head Start Child Care Partnership competition. So we all gulped when we saw that coming out of the White House. So what I want to say is by December 10th, and you know we did the paneling rolling over 6 weeks, so we will not have everybody that's going to be announced on December 10th because we won't be at that decision point. But clearly there will be a group of applicants that we will have sufficiently negotiated with the agencies and that will be announced that day. But what I want to be clear to the field is those announcements are not going to be inclusive of all the applicants that were successful, and that's really important. As you know, Congress gave us till the end of March to award these grants, and with the FOA, as you know, got out a little bit later than what we had anticipated. So we're in a little bit of, I'm not saying a time crunch, but we must be very deliberate and with good speed and thoroughness as we begin the process of the decision-making and the negotiations. What I can say to you is that we will be reaching out, our regional offices will be reaching out to those applicants who are in a fundable range. And that is a very different term than a preliminarily selected, which we often use with DRS. The reason why we want to reach out to those in a fundable range, which means no commitment, we just want to have a discussion, we want to begin to talk about your application, is because we want to be prepared when we understand how much funding. We know we have state allocations, but we also know that maybe there are some states that may not use all of their allocation, which is going to allow us some flexibility to reallocate those funds. So we want to sort of reach out to all the applicants within a state that are in a fundable range. That doesn't mean that everyone's going to be funded, but it could be that everyone is funded. So those conversations will, I bet there might be someone in the audience who's already had a call from the regional office. But again, we want to begin to do that work. And having said that, since we now know there are some states where we now know who is in the fundable range, and those that are just being paneled, we won't know for a while. So again, this is a rolling process, and that's really what I want to stress most of all. But we are excited with the applications, and we just feel like this is a really important time for Head Start. I think the fact that Congress had the faith that we could take this early Head Start model and infuse it into infant, toddler, child care programs is extremely important. But it calls to the importance of our leadership, your leadership, should you be a successful applicant, in really implementing these grants well and timely. And I'm sure you're going to have some questions about the implementation of the grants. I think the one thing that I would want to stress, should any of you, be the successful applicants, the most important thing is the oversight and the infrastructure that you have as an entity to ensure that you've got the adequate staff, not the current staff that you just want them to do more work, that you have an infrastructure that can expand to really do the kind of oversight and support these child care centers will need and will warrant as they work to achieve early Head Start standards. So I think there is a heavy responsibility on the grantee, as there always is, but now you're not going to be dealing with the kids in your own home, you're going to be dealing with many, many partners across your communities. So I know that there'll be questions, so I will just sort of summarize that and then move on to the next issue. The next big thing, and I know you've heard this from us if you've been at any national conferences, the NPRM for the Head Start Performance Standards. I think we have been talking about it for a couple of years now. And as a dear colleague of mine once said, sometimes procrastination is good. And I think in this situation, the fact that we took our time, more time than you might have wanted, but I think the landscape has changed, and I think it allowed us, the landscape of early childhood systems, with the race to the top and the states paying much more attention to goals and objectives and outcomes for those in early childhood education. I think it was a good time for us to be in almost near the point where the NPRM is about to be published. We do think now it's still got to go through, there's still several levels of clearance, but we do think you will see the NPRM probably in the first quarter of 2015. I was around when we did the last rewrite of the performance standards, and I can remember we got about 16,000 comments, and and that was kind of a paper time when everything was in paper. I think that was in 1998 when we did that. Now it's everything being electronic. I think that the process will be much more timely and efficient. But I'm going to make a plea to community action agencies. When I think back last time, well, and what I want to say, let me step back. It is very important that these are promulgated in the current administration. And I say that because in any change in administration, if things are not finished, they often linger. And I think for those of you who are around when we did the child care regs, and that was a really tiny reg, we had it completed and ready to sort of almost be issued in one administration, and I think it almost took 8 years for us to get those out. So we want to do a really good job so these can be promulgated within the next 2 years, and I think there is the time to do that. However, there's one thing that I think the community action agencies can help us out with, and I'm going to harken back to the old days where someone would mimeograph or a letter and send the same letter to 1,000 people, and they would have 1,000 different signatures. While that doesn't necessarily serve as a powerful punch to influencing the outcome of the final promulgation of the standards. And again, it's also very time-consuming because anything that comes in under any separate document We need to log it, be accountable for it, tag it. And so I think to the extent we want substantive comments, that NPRM will be out for 120 days. We expect very meaningful comments. I think, I'm sure you can tell us what you like, but I think those things that you want to make a critical feedback on or a comment about, I would encourage you not only state your sort of position, why you think it should be as it is, but also state what you think it should be as an alternative. That's going to help us when we review all the comments. So I think enough said about the NPRM. The budget, I will say, as you know, we're on a CR. It could be likely that we have a CR for the entire year, which would be okay. At least we would know our budget figures. But that's something that obviously Congress is going to have to decide. But I think we're confident, although I never thought we would shut down and have a sequestration. So I'm not going to predict anything, but I do think that we're hoping that the figures will be finalized for this year, and I think that allows everyone a level of stability and calm within their own budget shops at the local level. I'm going to ask another thing that's on the horizon, and actually it's going to be effective on my birthday, December 26th, is the new Omni Circular. And I'm going to ask Belinda to, and I know folks have been asking a lot of questions about that, and I'm going to punt to Belinda to give us a preview of how we can support you in understanding it and the impact.
Thanks, Ann. So what I'm going to spend a few minutes talking about are the new uniform administrative requirements, the new cost principles, and the audit requirements for federal awards that will become effective December 26th of this year. You probably heard these referred to as the Omni Circular or the Super Circular, but really they're just a new set of things that we've seen from the past. What's unique about the Super Circular, or the Omni Circular, if you will, is that it does away with many of the existing grants management, audit, and cost principle regulations that we currently have and replaces them for substantially all grantees with a uniform set of requirements. In fact, the Super Circular uses language that includes all funded organizations, whether you're a grantee, grant-funded organization, delegate agency, or subrecipient. They're all termed as non-federal entities. So we're going to see this NFE designation. The only type of recipient that's excluded from these changes are for-profit organizations. So all of you community action agency folks who are listening, this change, which is an OMB level change, not a change specific to Head Start, but certainly will impact you, will be taking effect. Just going to highlight a couple of the major changes. I mean, one of them is that the audit threshold, the single audit threshold, has been increased from $500,000 to $750,000 in aggregate federal funding. So if an organization is getting over $750,000 or more, they will have to comply with single audit requirements. And when do they go into effect? As Ann said, they're on her birthday. I think OMB planned it that way. But for any award or award increment made on or after December 26th of 2014, these new regulations apply. So what goes away because of these new regulations? Well, all of the prior audit circulars that were in use will be combined into this new circular. All of the cost principle guidance that's now in Title II of the Code of Federal Regulations are cost principles at 2 CFR 220, 225, and 230. Those are all going to be superseded, as well as the grants management regulations at Part 74 and Part 92. So a lot of what previously existed is going to go away and be replaced by uniform standards. If I was going to say, what does this look most like? It actually looks most like 2 CFR 220. So it really looks more like what we used to apply to colleges and universities, although now it's applicable to all grantees. Just as a caution, there was no one set of regulations that OMB took a look at and said, gee, we really like those, let's make them universally applicable. They took bits and pieces from different regulations, and they also developed some completely new language. And so there is not a single grantee listening today who gets a pass on paying attention to these changes. You will need to sit down and look at your policies and procedures and all your fiscal operations, compare them to the new requirements, and make sure that they are in alignment. The new regulations in many ways are similar to the prior regulations. So grantees, community action agencies who maybe typically had more complex fiscal arrangements have had maybe more sophisticated fiscal management systems, may not see a huge number of changes. But you'll definitely want to take a look at some specific areas like subrecipient agreements and monitoring, looking at how you identify and define facilities and administration costs, how you cost allocate for direct costs. Indirect costs are a big emphasis in these new regulations. Gives you the option of a de minimis rate of 10%, talks a lot about negotiated indirect cost rates, and it actually breaks out among different kinds of organizations. So even though these new regulations are one size fits all, as you read through, you will find some variations based on organizational type that you'll want to pay some attention to. As I said earlier, in general, there are not a lot of major changes, so the basic requirements for allowability, necessary, reasonable, and allocable, those really haven't gone anywhere. But it is important to take a look at some of the individual items of cost that are included in these new regulations. So what used to be our Appendix B, individual items of cost, all you fiscal folk out there will know what I'm talking about. But those individual items that are addressed in the cost principles have changed, and there's more of them to take a look at. But in particular, I suggest you take a look at compensation, both in terms of fringe benefits and personal services. In those individual items, take a look at the language on contributions and donations. Take a look at depreciation. As best we can tell, the ability to claim a use allowance once a facility or an asset is fully depreciated is no longer available. There's some minor changes in fundraising and investment management costs that you'll want to take a look at, as well as some changes in the language relative to proposal costs. So the Office of Head Start is working right now closely with the Division of Grants Policy on the ACF side with our counterparts to get some additional guidance out to Head Start grantees. So those of you on the fiscal side who haven't registered to get updates from the Early Childhood Learning and Knowledge website or the eClick website at Head Start, this would be a good time for you to register so that you see those updates as they come out. Thanks.
Thank you. The last thing I want to mention, just an overarching update, as some of you may know that Linda Smith has been facilitating conference forums for agency directors, national organizations, to really have just an open discussion about our national TNTA system, both from the Office of Head Start and also from the Office of Child Care. Clearly, with the Early Head Start Child Care partnerships, and we just actually very recently announced a TNTA award that was jointly funded by both the Office of Head Start and the Office of Child Care to help us in the early implementation of the partnership grants. But we really want to look across our systems to see where there is duplication, to see where we could be more effective as you and the communities work closer and closer with states, and clearly be it DOE, be it state licensing. We really want to make sure that to the extent possible, we can break down the silos. If we're serving the same families, what are the things that we can do together that would really make more sense from a training and technical systems perspective and really how we can leverage our federal resources much more effectively. And it was interesting because yesterday several of us met with Jeannie and Seth at the Office of Community Services, and I kind of think I know a lot about what's happening there, and here is the sister agency, and I was actually unaware of the TNTA resources that emanated out of the OCS, and again it was a reminder, where are those things where in the world of community actions you might have certain TA and we have certain TA and we may be going in for the same systemic issue that we really, so again it's this issue of where should we be coordinating better, which to me would give better service to an organization, and you don't have several entities coming at you from different perspectives really to address the same issue. As you know, our national centers and our TNTA contracts are coming to a natural sort of end. So it's always an opportunity for us to say, okay, what was working and what was not in the current system. And I think we have many, many positives about the current system, but there are things that always that we can improve upon. So again, that's something that we will see notices in the future about the funding opportunity announcements and the contracts for TNTA, but that's something, again, that is, I would say, a substantial undertaking that will, transpire in the latter part of 2015, but it's a big deal because there are significant dollars, as you know, and half of our TNTA dollars in the Act go directly to grantees, but how we spend that other half, again, we just want to make sure that we are producing the types of cutting-edge, evidence-based materials, that the messages are consistent, whether it's from the National Center or whether it's from one of our state TNTA providers, our grantee specialists. So again, that's an activity or an effort that we'll be putting a lot of energy to throughout the rest of fiscal year 2015. So those are really, I can't think of any, other than we want to get into some of the meaty topics that you've asked us to address, but I'm going to ask my colleagues, is there any other sort of update that I've overlooked that I just overlooked that we should be sharing with our folks here? Anything? Okay. So the areas that you specifically asked us, we talked about the early head start child care partnerships, and the other 4 areas are really all kind of tied together. It's monitoring, it's class, it's DRS, and it's a 5-year grant oversight. So I think what we might start out with is to talk about monitoring, and I know that both Adia and Ross have done webinars, trainings about the new aligned system, which is very much tied to the 5-year oversight, and I do think one of the biggest shifts for us in the Office of Head Start, and I think for you in the field, is moving from an indefinite project period to a 5-year grant. We had a wonderful conversation with a CAP executive director in Region 4 who has now 4 5-year grants from us, none of which align in the same calendar period. And I think whenever there is legislation that is enacted, there are always sort of unintended consequences or challenges that come up after the fact. And I think the management of multi-grants, all representing different grant periods, expiring at different times, is certainly a challenge that you're probably all experiencing, and it's sort of not lost on us. And I think some of the planning for monitoring and how we try to align that system, there was a lot of thought given to how can we reduce the burden to grantees who have multiple grants and still really have a monitoring system that works and allows us to make determinations which are also tied to DRS. So it is all connected, but I think the challenges are not lost on us, and we have and we want to continue to talk to grantees and understand more about the managing the multiple grants. But I think for us, both operationally, for our regional staff, for our TNTA folk, and certainly for you, this has been huge, and we're just at the very infant stages of figuring out how to manage multiple grants. But I think this is what we've been given. These are the statutes, the mandates, the regulations, and we've got to figure out the positive solutions to figure out how to do it effectively. And I would say the most important thing I've always felt is the federal to local is so important, because I think that continues to give you the strength to really design programs that are reflective of the needs in your communities. So why is Ann saying that now? Because I think our ability to do this operationally well helps preserve that federal to local. So with that, I'm going to turn to Adia and to Ross to talk about monitoring, and then we can get into the subgroups, subcategories.
All right, thanks, Ann. What we'll do, Adia will start off and talk around the aligned monitoring system, and then I'll address some of the oversight procedures that we have in place, and then Fran will follow up talking a little bit about the grant application process as it goes over a 5-year period.
And maybe one thing, Adia and Ross, when you speak, because I know we're doing a lot of talking today, we already have materials on the website that really that folks can, pull down PowerPoints, but I think today we want it to be a conversation, but we do have materials already that are posted.
I think that's right, Ann. There's two things. There was a place in this presentation where I want to make sure that people had opportunities. Lisa, when
do we want to see if there are any questions about? Okay, I think we
do have a couple that have come in there.
Okay, we'll take a couple of questions on the updates and then figure out, and then go on to the monitoring. Oh, my. The first question is, have heard that OHS is looking to defund CAP agencies as grantees in favor of standalone grantees. Can you address this? I want to say, the person said conception, I want to say, can you address this? There must be a misconception. This is absolutely a misconception, and I should have said at the forefront, when a community action agency is robust and working well, there really is, when you think about the comprehensive services that you have, the linkages to all sorts of other supports for families. Some of you also have supports to housing. I think Head Start is well positioned and well taken care of, and a strong CAP. There is absolutely, I just want to, that is a myth. It's not accurate. It's not true. We have stunning examples across this country of really high-level, cutting-edge CAP agencies who are showing progress that kids are making, showing great outcomes, strong financial services. I do think what we all suffer, and this is true for any entity that has a Head Start grant, when an agency gets into trouble and an agency begins to make the newspaper and it's a CAP agency, then the whole world thinks that all CAPs are bad and all Head Start is bad. So I think that we are such a public brand. You could be an early childhood, you could be a school system, you could be anything else in a community, and you're only one in that community. So if there's an example of a Head Start program and a CAP agency, it could be a CAP agency that's making the papers, our reaction is, oh, because what it does, it casts, I think, a cloud over all of us. But if anyone thinks that the Office of Head Start would want to defund a CAP to have a standalone, that is absolutely, positively not the case. So I rest my case on that one.
Okay, well, we'll segue into something a little more concrete. This question asks, when will HHS respond to OMB on how they will implement the new super circular? And I think there's a bit of a misperception that agencies are somehow mandated to adopt implementing regulations. The language in the final regulations will become effective December 26th of 2014. There were sections within the regulations that were reserved for agencies if they chose to issue certain types of implementing regulations. But as best we now know, there will not be significant changes to the language of the existing regulation prior to its implementation on December 26th of 2014. So in terms of planning, in terms of, what do I need to compare my existing fiscal policies and procedures to, you should use the language in the final regulation for comparison purposes.
Thank you. And so I had one more thought on this whole issue of defunding. I mean, and I wanted to, as much as we are fervent in that is just noise, it's not truthful. What we're also as fervent about is that we want strong programs, whether it's an LEA, whether it's a CAP, whether it's a standalone, whether it's a for-profit. We want strong programs operating our Head Start programs. If any program falters to the point that it should be defunded, it doesn't matter. We are blind in terms of the category of that program, regardless of the entity type. So I also want to say that too, because it's, as strongly as we support our, relationship with community action programs, we want to say we support strong programs. If programs are struggling, we want to reach out and try to assist those programs. But we know under every category there are some programs that just are not going to make it. And what we want, if we recompete those monies in that community, no one is saying, oh, we definitely want a standalone. We want an agency that can step up and really provide quality services. And I have to say, there are communities where CAP agencies had to recompete or were defunded, and it went to another CAP agency. So there's not a record there of us trying to choose or pick a non-CAP. So okay, now I'm done.
Okay. Oh, great questions. Thank you for asking your questions. And again, I'm Adia Brown. I'm the monitoring lead at the Office of Head Start. And we have had an exciting week at the Office of Head Start. This is actually the very first week of us implementing the aligned monitoring system. So if you're a CAP agency and you operate Head Start programs, you have gotten inundated with tons of information about our new aligned monitoring process. We have up an expo that lots of people have gone into. To date, we've had almost 6,000 people attend the expo to learn about what the new aligned monitoring process is. And some of the key items from that new process that people are really learning about and that really are affecting people right now are the fact that monitoring is more frequent than it was. We used to just do triannual reviews, and that was very aligned with having a system of indefinite grantees. And now we don't have necessarily triennial reviews anymore. What we have are monitoring events, and those events happen to line up with your 5-year monitoring, with your 5-year grant. So the new monitoring events are more often, but they're also a lot more focused. So people are able, when we go out and we do a monitoring event, it's one issue at a time. And this year in FY15, like I said, the monitoring season just started on Monday, and that was pretty exciting. Anne's giving me the slow down sign over here, because I do talk fast.
Tribal programs have called for Miss Quick.
They call me Miss Quick. I do speak quickly, so Anne's giving me the slow down sign. But I am excited. This is very, for us, really having the opportunity to align the new monitoring system and to have these monitoring events where we can be much more focused with grantees and really understand each one of the different things that we're trying to look at and give the grantee more of an opportunity to tell us where the quality is in their program in different areas has been really been an exciting endeavor. And before we started the monitoring week, we have gotten lots of questions from grantees, all types of grantees, CAP agencies, standalone agencies, around one of the things that we're doing for FY15 for the first time, and that is our new environmental health and safety protocol. There's been tons of questions about the environmental health and safety protocol. How are we using it? What are the different things? What are the elements and the components of that protocol? And so we've been doing a lot of work about, making sure that people get sort of the clear messages around what's going on with environmental health and safety. And there's two things that are happening with environmental health and safety and the new protocol. And the first thing is that we're going to programs to really make sure that, as we've always done in the past, that we understand how well programs are meeting the Head Start performance standards and how well you're meeting the things that relate to the Head Start Act. That's our main focus of the protocol, and that's aligned with what we have typically done in environmental health and safety review. The other thing that we're doing with the protocol this year is that for the first time in the history of that I know in Head Start is we're doing a full inventory. So we're doing a full and complete inventory of all the Head Start sites and centers and classrooms to really help the Office of Head Start understand what the safety looks like in Head Start and how well we're doing in that area and where we need to have quality improvement and where things are really great. And so the new protocol is designed to help us do those two things. And there's been lots of questions about the protocol because we added targeted questions in the protocol that are not necessarily related to Head Start regulations. Now, this is not the first time we've done this in the history of Head Start. I think it's just one that because this is health and safety, and grantees are very nervous about health and safety. Folks don't want to have deficiencies in health and safety. When we added these new targeted questions, people had lots of questions. But we've done this in the past. For example, when we had Hurricane Katrina, we added targeted questions that actually related to emergency preparedness. They weren't necessarily rated, all the targeted questions weren't related to a Head Start regulation, but it did help us to understand where we needed to make quality improvements in programs' readiness in the case of emergencies. We also did it when the Head Start Act first came out in 2007, and we started talking about school readiness. At the time, we didn't have regulations around school readiness, but we wanted to understand where programs were with school readiness. We wanted to understand more about what was happening with school readiness, and we collected a lot of data to help us sort of build technical assistance and more things that can help programs actually improve in that area. So in this case, in this new environmental health and safety protocol, we're doing very similar things, and we're understanding more about facilities and what are the things that actually make facilities safe for children. We did a lot of research. We went out. We talked to a lot of people in the industry that deal with safety to help us understand the most important indicators to look at around safety. So hopefully, if folks have more questions about it, we're here to discuss and to talk about it. But that's sort of been the big issue, right, Ann? I think that's been the big issues around this.
And I think you were kind in saying we got questions. We got some pretty tough remarks, and some people were angry. And I think some of it was miscommunication or not, folks were not clear enough about our intent. And I think one of the things we're doing, in fact, we're finalizing it, because we did get a lot of inquiries. We've got a letter coming out from the Office of Head Start, we hope no later than Monday, which really is going to put in writing much of what Adia said. And I think the one thing that we want to be clear about as it relates to this, because it was a lightning rod for folks, that anytime we cite a finding, it's got to tie back to the Act, or it's got to tie back to the Head Start performance standards. So if there are questions that we're asking that cannot be tied back, and the question is answered in a way that there is a concern, it's not going to end up as a finding. So I want folks to be, we're not wavering, we're not generating findings that are attached to something else outside of the Head Start Act or the Head Start performance standards. So I just want to just be clear about that for folks.
That's great. Thanks, Ann. So that was one of the hot topics and the big issues. And although we had lots of comments and lots of questions, we also, in this very first week, as people are starting to experience the new monitoring process, we've gotten a lot of positive comments. And that's been really exciting for us. As people have started to experience the new monitoring process, they're saying that they are enjoying the teams, that people are coming out, that people really know their stuff with health and safety. And so not only are they finding it to be a pleasant experience, but they're also learning a lot along the way. So that's been pretty exciting for us as well.
So I think this is an interesting question because it leads to, I think, one grantee feeling overburdened by the new system.
Mm-hmm.
Do you want to read I think it'd be helpful to read the question also for everybody.
Okay. See, they got to read the question ahead, and then it came down to me, and like now I'm.
All right, I'll read the question. The question is.
I have it. It's just, I want to know what the content is. So it says, we are a grantee in the second year of our 5-year grant. This year we are receiving 3 separate 1-week-long reviews versus 1 triennial. The time committed is extremely burdensome for the grantee. How are you thinking about the time and the effort burden? So one of the things that when you go to the expo and you hear different things about
when you say the expo, what is the expo?
We have the virtual, the expo, the monitoring virtual expo for the Aligned Monitoring System. And if you go to the ECLIC, the Early Child Care Learning and Knowledge Center, if you go
ECLKC,
if you go there, you can click on our banner and you can watch the expo. So for a very limited amount of grantees, because they've already moved forward. So we have some grantees who are in their 3rd year. We have some grantees who are already in their 2nd year
of their 5-year grant.
grant. So this will not actually happen again for grantees once the system goes into its next 5 years. But for this first time, we have to catch up with some grantees. So there's some grantees that because they're already in their 3rd year, we have multiple events that we have to do with that grantee.
Which typically would happen once a year, but because they're already in the 3rd year, that means for that small number of grantees, you're going to be doing multiple events, but for everyone else, they'd be spread out. Okay.
So for these grantees, those multiple events will actually happen in the same year. And so we have something called monitoring event coordinators, which really we are thinking about the burden that places on grantees, what that actually looks like. And so the monitoring event coordinator works with the grantee to make sure that we can actually do those events, actually talk to them about when they should happen. They actually work with the grantees. We didn't put them back together into one triennial review because we still wanted to have the grantee to have the opportunity to look at each individual event one at a time. Grantees who have experienced that in the first week have said, although they were nervous about it, they are very happy that we're doing it like that. They're better able, everyone in the staff doesn't have to be involved in the event. If it's, for example, if it's a fiscal event, the only people that need to be involved are the fiscal people who actually do that. If it's a health and safety event, you only need to have those folks involved. And so for the grantees who are actually getting multiple events in 1 year, we know that that's going to be a little bit more stressful. So we have folks to specifically work with you and work with your schedules to make sure that it doesn't overwhelm you across the course of the year.
So I think the transition, again, from 1,600 or 1,700 grantees from indefinite project periods to and this is what I addressed at the beginning, I think it's the biggest operational hurdle for us. That transition, which is not yet complete, really does create some wrinkles that is going to take us a couple of years to iron out so we're on a steady, more measured course for all grantees.
Right. And Ross underscored something in the question that, because I'm sure he did that because he wanted me to focus on it. All of your monitoring events are actually not 1 week long. So it actually depends on the type of event that you're getting and the size of your program. So all of the monitoring events, even if they happen in the course of 1 year, they all don't necessarily encompass a full week. So we have some, for example, some health and safety reviews that are only 1 or 2 days. They're much smaller events because it's smaller programs, and we only have to do one thing at a time. So it's not always a full week. That's one thing, Ross?
This is Biz real quick, having just lived through our health and safety in San Diego that ended yesterday. So thank you, and we did really focus, and I just have to put a plug in. We were nervous, but the team reviewer was excellent and went to every single classroom and every single center, and I appreciated it. Thank you.
Thank you, Biz. That's awesome. What's nice to have live feedback.
You know, one thing I will say, and I think having an inventory, and this is a big deal, we are required by law, actually by statute, to provide a report to Congress every 5 years on our tribal facilities. And they actually have asked us, I mean, part of the report is tell us the condition, ownership, and there are 3 things, and the federal share. We don't have, when you think about how many facilities we have across the country, this is an $8 billion program. One of the things that folks always are certainly concerned about is the lack of any kind of money for facilities. You know, for us to do anything in facilities, we depend on people not spending their budgets, which is a terrible thing if people are leaving money on the table. But that's how we've been able to support any kind of major improvements or construction or purchase over the years. It would be very helpful, and I think Linda Smith has been she's been really a champion on this, saying if we ever want to make a case, we need the data. We should be able to say, We have 6,000 facilities. We have federal interest in, whatever, maybe 40% of them. Maybe 30% of these facilities are coming to the end of their life, aging out. We have no ability now to even begin to project what kinds of funds we would need to really do facility planning over time. So the data that we're collecting now as part of this sort of outside of the Head Start regulations, things we're looking at, is going to be able to give us a picture that if Congress asks, if GAO asks, we can say these are the conditions. And by us seeing them, we also have to own the issues and the challenges as well.
So I'm probably going to ask this question, and then I'm going to let you go, Russ, because I don't want to run out of time. But this is another one that folks have been very nervous about, and it's family child care. So I've gotten in the last few weeks lots of questions about family child care, and this one says, what regulations in addition to 45 CFR 1306.35 will you be using to assess health and safety in family child care programs? So I don't have the protocol in front of me, right? But what I know that people are nervous about the family child care homes is that they sort of feel that we're going to start looking at family child care homes and expect them to be exactly like centers, and we don't. So we know that there's a set of regulations for family child care homes that actually were specifically drafted to understand safety in a family child care home. And there's some regulations that were drafted for Head Start overall. So there's regulations that we drafted that apply specifically to family child care, and some that relate to no matter what option you're in. Existing regulations that relate to no matter what option you're in, and that they apply to family homes, to center homes. So if we would go see something, for home-based programs, we don't look at the facilities, but we may look at some safety issues like are folks engaged with the children, are children sitting like we have something in the protocol right now that asks whether or not children are in high chairs and they're out of reach of adults. That question is not a regulation, but that question helps us to understand whether or not the child could actually fall. We had that actually happen. We had a child actually fall out of a high chair and get seriously injured in the program. So there's regulations that apply specifically to family child care, and there's some regulations that apply to any type of option that we would look at. And so since I don't have the protocol right in front of me, I can't tell you what all the individual ones are.
Is there anyone on the panel that can think of something that was outside of the family child care regs where we would be applying another Head Start health and safety performance standard to a family child care home?
The only ones I can think of are ones that are not health and safety. Those are the ones that come to my mind right now. So
well, that's right, because if anything out of, so what would it be outside of?
Yeah.
I think there's questions around staff qualifications. I think there's questions around.
But they also relate to family child.
That's right.
They also,
yeah. And I probably misunderstood the question, but also the criminal record checks, those things.
Yeah. And maybe, and so I think that we got to figure out maybe with Denise sort of the vehicle, if we want to sort of research this a little bit more and come back with an answer. I'm sure there's a place where you could post. So I think we got a challenge here, and no one can think of one immediately.
But most of the ones that are in the protocol, we made the protocol, so we use those specific regulations.
Right.
There obviously, because I keep getting this question asked over and over again, there obviously is some concern about some health and safety regulations that we're asking, and we're asking about everyone, that they don't think applies to family child care homes.
Okay.
So we need to go back, we need to look at it. These questions come up more often.
Okay. And I think we really do want to leave sufficient time for questions at the end, so I know Ross and Fran are going to be talking more about sort of the 5-year and the oversight and the operations. And then we really also want to make sure that we have time for Belinda to talk about, I think, some of the ways we're approaching DRS a little bit differently this year in terms of the cohort 3, some of the things we're trying to do up ahead. And so why don't we continue? But we're going to be a little bit conscious about time because we want to give you the time to ask us questions.
Okay, Ross. Thanks, Ann. What we wanted to also talk about is, as Ann has said several times, the change from indefinite project period to 5-year project periods not only impacted how we monitor, but it also impacts how we want to provide oversight of grantees. And the piece that Ann talked about earlier was what we want are strong programs. What we are trying to accomplish in the oversight process is a process both nationally, regionally, and local for how programs can succeed, how they can be successful in what you do. You know, it's one of the things that I look at this, the 5 of us are here, it's kind of unique in that all 5 of us have either worked in or have been in Head Start programs over the years in very different capacities. So we understand some of the concerns that are out there about, well, now that we're going out and monitoring with monitoring events over the first 3 years of a 5-year project, isn't that going to be cumbersome or invasion on the grantees? But Sadia was saying, no, we really see this as an opportunity to build relationships with grantees so that grantees can be successful. If we're funding an average grantee is now, I think, around $5 million. If we're funding a grantee 5 years, that's $25 million we're putting out in the community. We want that grantee to succeed. Now, as Ann also said, if for some reason a grantee is unable or unwilling to succeed, that's a different issue. But that's not the majority of Head Start programs and grantees, and certainly not the case with community actions. So I just want to start with that to set the context of when we are looking at oversight, clearly the main piece that we see as critical in having this work is the relationship between the community, the regional office and the local grantee, particularly the leadership at the local grantee. Leadership meaning governing body, policy council, the executive director and management staff all provide leadership that will focus or drive that program to either be successful in the quality of services that you're providing or with the challenges that you have to face. So a lot of the emphasis will be placed on really working with leadership within grantees in order for them to be successful. In doing that, we've implemented several procedures, but I'm going to talk really about 2. We've implemented, and for some regions, this has been the case that has been going on. Others, this is new. We implemented monthly contacts with each Head Start program. That's to talk about what is the data that we're seeing, how is it relating to how the program is operating. But it's also looking at providing an opportunity for grantees to talk with the Head Start regional office about here are some of the challenges that we're seeing, or here are some of the innovative things that we're thinking about. How do we want to work together so that we can be successful? The other piece that we're implementing is that we intend to make annual visits to every grantee that's in a 5-year project period, which means shortly that all programs will be in a 5-year project period, so each grantee will be receiving an annual visit obviously every year. Defining the definition of annual, thank you very much. And what we want to see there is that those visits could be or would be from the program specialist, but could include also the fiscal specialist from your regional office in order to have greater understanding of how you operate and, as importantly, understand the context from which you operate. Grantees are in very different communities, obviously some very urban, some very rural. You operate differently in there. It's important for a program specialist, a fiscal specialist to understand that, and there's no better way to do that than to be out on site so they can be in communication with the governing body, with the policy council, and certainly with the management staff out there. We see this as a process that allows a grantee to be successful. Again, I want to reemphasize what we're trying to do is develop a process both through monitoring and the 5-year oversight to have grantees succeed. That will include identifying the challenges and getting TA into programs if needed, but it also includes recognizing the strengths and innovation that's out there among programs and how do we build upon that. So that's really where I'm going to stop as far as the oversight piece, but turn it over to Fran.
Well, I just want to make a comment because it really is, I think, one thing that you didn't say that you always say when you talk about these 2 points. One, a common complaint that we've heard certainly from the communities is, I have never seen my specialist in 5 years. And we know how important, we talk about how important relationship building is within agencies. Well, it's also important for the federal and the local to build that relationship. And so I think while they are out there to learn and to understand, you're also building the relationship. And I think that's what's really important.
Thanks, Ann. Fran.
Yeah, and I think that's a great segue, Ross. Thank you. So I think what we've been working hard to do is to try to implement some of the vision of oversight. And there are a few things that, Ross, one thing I wanted to add to the site visits, and they may not be annual for everyone, but that's really our goal and what we're striving for. And we do think it's critically important. We know that we sometimes have change of staff, and so we want some knowledge transfer, and we want, to the extent possible, to get our staff back out in the field, you know, as close to annually as we could possibly do. When they do those visits, we've asked them to spend time, particularly in the first year, with members of the governing body and your leadership team. And we also suggested, to the extent possible, you know, some of you have very large programs with a lot of sites and centers, and it may be that your governing body members haven't had an opportunity to actually see services in action. So to the extent you can, we'd love to include your governing body members on some of those site visits as well, and we can all learn about your program together. And it's also a wonderful opportunity to be able to really showcase services in action. So
thanks, Fran, because that's important. And on some of the annual visits that we have, that program specialists have made, the feedback from the program specialists has been very, very positive about how engaged governing bodies have been in going out and meeting with program specialists who maybe for the first time, as Ann was talking about. So thanks for bringing that up.
That's right. And not only that, we've also heard back from our specialists that this has really kind of breathed new life into their work, because otherwise, you know, it can become very bureaucratic and feel more like a paper-driven process. But not only the telephone calls, but also the ability to visit with you directly, I think has really helped to invigorate their work as well. And so for that, we thank you. We've talked a lot about the 5-year grants, and I think it's not news to anyone at this point how the 5-year grants work. There are particular challenges. I think our monitoring team has done a fabulous job of being able to project ahead and realign the monitoring system to be able to accomplish this. We know that we still have challenges in operations, and where we can, we want to hear more from you, especially in those cases where you're operating multiple project periods, maybe more than 5 budget periods in a 5-year grant. And, you know, there's just a lot of complexity that goes with it. We understand that. Reporting is challenging. Grant applications are challenging. But what we've tried to do is really get this 5-year process off the ground as a new way of thinking. So we released some IMs, and if you haven't had a chance to look at those, you can go, and I know we've said eClick 50 times today, but you can go to the ECLKC and look at the IM that speaks more to the 5-year process and the purpose. But one of the major emphases on there is the, is this something I should read now, Rob? No. Okay. All right, thanks. One of our major emphases is to look at that 5-year project period as an opportunity to think about where do you want your program to be in 5 years. So for the last few years, we've spent a lot of time talking about child assessments and aggregating child data, analyzing it to try to improve services for the children that are currently in care and to make changes for example, for the coming year. And we've talked a lot about school readiness goals. With our new, what we're calling a baseline grant application, we're encouraging programs to take a look at the entire 5 years of the project period and think about program goals broadly. where do you want to see your Head Start program? What kind of differences will your program make in the community over a 5-year period? And that includes school readiness for children, the kinds of changes you want for your families and your communities. So it's an opportunity to sit down, really try to define those, and define those in a way that you can actually measure. Some of it will be data, some of it will be narrative, but we want you to be able to look back and know what you've really accomplished over the 5 years. So this baseline grant application, instead of sending you the old instructions every year that are like, 15 pages, and by the way, here's the money and the kids, and people got so used to them, they just said, what's the money and how many, what's our enrollment number? Now that's just basically a funding guidance letter that's a couple pages. The application instructions are available in the Head Start Enterprise System for everyone to take a look at. So if you haven't done that, I would encourage you to do that. Those instructions talk more about laying out those goals and objectives, and then in future years of the grant, reporting back on the progress that you're making and the kinds of adjustments that you think you need to make. Sometimes the assumptions you have at the beginning really do need to be revisited, and then you can realign that and let us know how it's going from a progress perspective.
Fran, let me break in and I'll ask the question that the listener was asking. So you're now talking about the things that we have in place to support folks that are writing that first year grant for the 5-year. And I would say the Office of Head Start, we're kind of getting our act together and being more clear about what we expect over the 5 years. We have a bunch of folks that transitioned early who are like in the 3rd year. They're now, so the person said, well, I'm in my 3rd year. Do I have to go back and sort of create goals for the 1st year and the 2nd year if I got to have goals for 5 years? So what is the advice for someone who was not the benefactor of the guidance that we are giving folks now? What's the expectation?
Yeah, I think the answer to that is no. You don't have to back up 2 years because the possibility that those things existed then is gone. I mean, that time frame is gone. So we've tried to be pretty realistic and reasonable about this, and we understand it's a developmental process. A lot of people pour their heart and soul into their grant applications, and making a shift to kind of realign everything and follow these new instructions has been a heavy lift for some. If you're already in the 2nd or 3rd year, we put a little table in the instructions that I fear was not as clear as it could have been. We'd like you to still tell us about the first part. Tell us your goals and objectives. What could you reasonably accomplish in the years that you have left in your 5-year project period, and how might you report progress on that? You do not have to go backwards, and we understand it won't be as full of a planning process because you've got a 3-year period, but what we want you to do is to be intentional about that. The other pieces of the application can be updates. So it's structured so that you can see Section A includes the goals and objectives, and Section B, when you're in the continuation application, we're just looking basically for progress reports.
I see Denise there taking notes, and so I'm wondering, Denise, there are probably some things that we're saying that you're saying, wow, that's really important, and I know that not all community action agencies are on, and I just want to offer this as sort of so we can continue the dialogue, but if after you want to say, hey, I'm going to send you a Word doc, and did you really say these things? Because I'd like to get them out to all CAP agencies. We would welcome that, because I think anything that we could do, because sometimes these messages are clear to the folks that are listening. Sometimes they might need more information to really understand, but I think we don't see this as the end.
That's great, and we're recording, so we can certainly take a link out as well to other folks. But yeah, I'll run the summary document by you.
Okay.
That sounds great. The other thing that we recognize after using these new instructions for the last 6 months, that they do need some revision for clarity. Now, those folks that have begun writing, when the new instructions come out, there'll be a period of time. You don't have to write things all over again, but we're hoping that going forward things will be clearer. One of the other reasons that we're revising the instructions a little bit is that those instructions came out when we were still using what everyone referred to as the GABI, and you had to send in signature pages from your applications. Well, the grant application has changed now, and in partnership with the new application instructions, We're accepting your entire application electronically, and in fact, it needs to be submitted electronically. More and more, we're moving toward electronic communications and electronic signatures. So within your agency, you have the ability to manage all of the access to the Head Start Enterprise System that has a lot of the information the Office of Head Start has about your program in a nice, transparent fashion. It's where you report to us, but you also know what's been reported to us. You have copies of monitoring reports and past award actions and things like that. But the new grant application does require electronic submission. And sometime in the next year, you will also be picking up your notice of award electronically and reporting your SF-425 fiscal reports to us electronically through something called Grant Solutions. So a lot more information to follow. If you get communications from the Office of Head Start that have a link at the top that says, please click this link to accept, please do so. It's the equivalent of a certified letter so that we know for certain that you've actually received that communication. And if in fact no one in the organization has done that, we'll call you until we can get an acceptance of that communication because we feel that it's so critical. There have been times in the past, I appreciated Belinda's communication, there have been times in the past when we'll look at an IM or a PI and also send that to the Chief Fiscal Officer that's listed in the Head Start Enterprise System. We don't always do that. We encourage everyone to sign up on the ECLKC for these, but certainly for the 200, we will be sending that out to fiscal officers as well so that everyone has the same information. So I think that's everything that's new in the 5-year and grant application process, but I welcome questions. We'll do all we can to answer.
So we've got a couple of questions again about the protocol and monitoring, but I think let's hear from Belinda now, and then I can say 2 sentences on class after Belinda talks a little bit about DRS, and then we can open it up for questions. Belinda?
Thanks, Ann. It probably hasn't gone unnoticed that there is an emphasis in many different areas on maintaining adequate inventories of both personal property and, going forward more specifically around real estate or facilities as well. One of the things that the new super circular requires if you're claiming depreciation is that you do an annual inventory of real property that talks about federal share and so forth. So many of the regulations are moving towards understanding real property and facilities as well as equipment and other kinds of property better. One of the things that history has taught us in DRS is that understanding the facilities perspective of a grantee who's competing is very important, particularly if there may be mortgages involved, if there may be long-term leases involved, if there may potentially be a transfer of a facility to another grantee, what is the federal share that previous grantee has in a facility, because that may need to be compensated. Those kinds of things where there's a lack of clarity around federal interest, around the status of mortgages and the terms of mortgages, the types of leases that are in effect and how long those leases are in effect, and the ability to transfer those leases can really get in the way of smooth and efficient transition of services in DRS. So we at OHS will be utilizing, there are a couple of OMB forms that are in existence right now that do require, there's something called the SF-428, which requires annual reporting of, they call it tangible personal property report. So that SF-428 has historically been an aspect of the DRS application, but we're also going to integrate the SF-429, which is the real property status report, also hopefully going to be available in Grant Solutions in the near term. But we're going to be requiring and integrating information from that SF-429 into the application process with the goal of making not just the transition of services, but the transition of property and the establishment of property interest much smoother in the DRS process. And I know that there are a lot of questions, so I'm not going to spend much more time on that, but I want to leave some time for questions.
You know what, I have to admit, I was looking at the clock here and it said 1:53, and I'm thinking we have until 2:30, so we have, you know, almost 40 minutes, and Adia said, no, that's that clock is wrong.
We have 15
so we have, yeah, that's more, and I apologize because we would have cut ourselves off sooner. So I just want to say two things about class. I know that class has been not your favorite topic as it relates to DRS. And I think that this is, and again, we have regulations that are not flexible, that we must adhere to, and clearly this may be, and when I say to the community, and I do not even mention the word reauthorization, but certainly our focus is getting the standards finalized. But I do think for those of you in the field, this may be an issue that you might say, you know what, this is an important thing that we want to discuss when it comes to reauthorization. And I say that not from any judgment, not from any influence, but I understand, and I think what's happening, because as we look at our class scores nationally, now 3 years running, everyone's making improvements. I mean, the needle is moving. So when you get to the angst about the bottom 10%, which I think is the thing that bothers people the most, for example, and I'll use the emotional social domain, because that was always a strength of Head Start's, and there's been continued growth. When you look at the 10% now in social emotional, you could be over 5.5. Now 6 is good and 7 is even better, but you could be over, I think, 5.5 and find yourself having to recompete. I understand that's for many of you, you say that doesn't make sense at all. I am not making any judgments about whether or not it makes sense, but what I'm saying is it's a rule and it's a regulation that we have to follow. One gentleman did come up to me, and I think it was at Cap-Law, and you know, I knew that this was this strong program. That was the only reason that program was in DRS. And you know, my words to him were, you know you're a strong program. Go back to your community, rally the support, and write a damn good application. Having said that, we also know that most agencies have been successful in writing competitive applications that have been in DRS. And I think some of our greatest critics who found themselves in DRS, not for class, but for immediate deficiency, who really were very vocal in that first round, even today would say, you know what, we stepped back, and I think even though we hated being dubbed an agency that had to recompete, we're an agency that's better off for it. I'm one that always looks at the glass half full, and I know for many of you, you're probably not thrilled with what I'm saying now, but we're living with something that we need to live with, we need to adhere to it, and I think that becomes an issue for the community in eventual discussions, if that's what the community chooses as one of their issues. So, having said that, we got a couple of questions that came in. Adia or Ross on monitoring. Okay, which is your favorite topic?
My favorite. So there's a couple of questions that came in. I wanted to go back to the one about the regulations that were outside of 1306-35 because the power of technology, I was able to research it while everybody was talking. And so some of those regulations include things like licensing. We ask for those for both family child care homes and for other options. Safety inspections, and those are the inspections that you do of the family child care home. Whether or not there's pollutants, that's a general regulation for everyone. Whether or not toileting is separated from cooking areas, those are general. That just gives you some example of what some of the general standards are that are in the protocol that relate to everyone and not just family child care homes. There are two questions that came in that are very similar, and those two questions are about grantees who are in they're 100% in compliance, and they want to know why they didn't get the differential, why they're getting comprehensive instead of differential monitoring. And those are individual questions that I can't necessarily ask on your call, but I can tell you how to get the answer. And so if you went back to your regional office and they don't know why you're in the comprehensive setting, then they can actually contact your monitoring event coordinator, and the monitoring event coordinator is the scheduler who can better explain to the regional office, who can then explain to you how you wound up in which review type. And the final question for me was about how are we training monitoring reviewers to differentiate between compliance and data gathering questions. So what happens with the reviewers is that they're trained to collect data, so their job is to collect data, and they answer all of the questions. They're not necessarily looking for compliance or non-compliance or data. They're collecting all of the information that we ask them to about each one of the targeted questions. And then that data is given to the Office of Head Start, and then we look at the data and categorize the data into what information is for data, which information is for findings, which information is for concerns or deficiencies. So the reviewers, they're trained to collect data, and that's what they do. They're not looking at the data to determine whether or not the grantee is out of compliance. They're just collecting all the information that we ask them to.
Hey, and I have actually, and I know we probably just have time for one last comment, but this came in from one of the listeners, and I thought this was great, and Fran and Ross, you can take this for homework. But the 5-year goal setting process was quite a lot of work, but an excellent experience, and one that provided a great engagement opportunity with our stakeholders. That's a beautiful statement. Now, the challenge to us, will OHS communicate an overview of grantees' measurable goals so that we, the field, can better know what our colleagues are thinking about? I think that's a great question, and I think, yes, we can.
Yep.
So we have a few more minutes. I don't know that we have any more questions in the queue, and if we're done, right? But I hope this has been helpful, and you know, we offered Denise if this is something we want to do on a regular basis, whatever that, you know, Head Start always likes to define what regular means, right? But we would certainly be willing to have ongoing, you know, communication with our CAPs.
Great. Well, usually we would ask for a round of applause, but thank you very much for being here. We so appreciate it, and we'll be reaching out with some summary questions and things like that so we can make sure we're transparent and clear with the information coming back out. We are really appreciative of the comments that you had today, the thoughtfulness you put into the question responses. We, too, are here believing in strong programs. We believe firmly in the quality and ability of community action to be the lead provider of Head Start across our country, and when it's working well, it is a phenomenal way for families to really move the needle and become much more self-sufficient. And those 5-year windows, we look at families moving, and there's an opportunity there for us to frame some of that conversation, certainly. So we will be in touch. We will definitely be posting today's summary information, and the copy of the webinar will be put out to folks. Please feel free to share it with many others. We are welcoming Ann also to our Management Leadership Training Conference in January. If you'd like to see the live in-person show, 3 dimensions are always better than 2. We hope that you'll join us in Dana Point, California, January 6th, 7th, and 8th. And we look forward to taking you up on your offer for quarterly update webinars. I think nothing beats the information right from the source. So keep those thoughts and questions coming and in the front of your mind. And thank you very much for being with us today. And thank you again.
Thank you.
Thank you. Thank you, Ann, and your team.
Thanks, Biz.